Recursion Pharmaceuticals had a very exciting announcement last week. They are partnering with Nvidia, the premier AI chip company in the world, to accelerate their development of AI models. In this video, we'll go over that deal as well as some recent news, and we'll dive into exactly how their platform works, courtesy of Download Day. Let's jump right into it. Starting off with the deal with Nvidia. Recursion will receive $50 million as an investment from Nvidia. In turn, Recursion will develop AI foundational models for chemistry and biology in collaboration with Nvidia. Recursion will use the Nvidia DGX Cloud, which is an AI training as a service cloud, in the development of these models. This seems to me to be a very vague announcement, but I think it's meant to address Recursion's access to compute. Recursion had built in-house roughly the 60th largest computer in the world, but this was at the time of IPO about 2 years ago, and the world of AI and computing has changed greatly since then. With so much data available, access to more compute will only accelerate their development of potentially life-saving treatments for patients. This was obviously a pretty wild day for the stock, finishing up over 70%, which was down from where it opened, up about 150%. Continuing with the AI theme, back in early May, Recursion acquired 2 AI bio companies and will begin integrating them into their ecosystem. First is Cyclica, which has built 2 really interesting digital chemistry products. One of these is Matchmaker, which uses AI to predict pharmacology of small molecules. Pharmacology, according to Google, is the design or use of pharmaceutical agents that act on multiple targets or disease pathways. From my interpretation, this will address many new treatments, despite scientific advancements, failing in the clinic because they impact the desired pathway as well as others that cause negative side effects. By being able to predict the side effects, Recursion can predict what will be successful in the clinic, accelerating discovery. The other application is POEM, which stands for Pareto Optimal Embedding Model. The description of this was pretty vague, but I think it compares 2 small molecules and predicts what properties they will manifest when introduced to the body. This will improve Recursion's overall small molecule acumen, as they will better be able to compare the molecules before they put them in an animal model or develop them any further. Cyclica has used these applications to develop their own early-stage pipeline, as you can see on your screen now. Recursion has stated they intend to build their own digital chemistry expertise, and on top of their own work, this will give them a great springboard to build off. Cyclica will be integrated directly into Recursion, which is in contrast to Valence, which will operate somewhat independently from Recursion. Valence's goal is somewhat similar to Recursion's in using deep learning in the discovery process. They have developed low data learning algorithms for use in treatment design that can differentiate between small molecules with datasets too small or sparse for traditional AI approaches. When Recursion's CEO Chris Gibson was at a recent investor conference, he ranted and raved about what the Valence team has been able to accomplish, saying they've gone head-to-head and beaten teams with much larger organizations like Google DeepMind and others. They acquired both of these for $40 and $47 million respectively, with this likely being paid in Recursion stock. For more information on these 2 companies, check out the webcast from an investor event they did with Goldman Sachs. The link will be in the description. Let's look at the Q1 update and all the news that came with it. Recursion now has 5 programs in some stage of the clinic, with 3 in phase 2 trials, 1 ready to begin phase 2 trials, and 1 more in phase 1. They reminded us of the target they revealed at Download Day, targeting HR-proficient ovarian cancer, which we'll dive in depth on a few slides. Something interesting I picked up on is they said they have more than a dozen early discovery and research programs. This is in stark contrast to what they used to tout, which was north of 40 programs in research and development. For example, in the second quarter of 2021, they said they had 48 programs in research and development, which is now down to just a dozen. This could be one of 2 things in my view. It could be Recursion's OS working and whittling down the amount of programs before good money is thrown after a program that would ultimately just fail in the clinic. It could also be Recursion putting those programs on the back burner, taking them out of active R&D to focus on programs further along with more potential while preserving cash in this environment. Something that kind of supports the latter of these theories is looking at their career page. They used to have dozens of open positions listed here, but consolidated it down to just these generic open positions for each department. This makes it appear that they have all the talent they need and are happy with where they're at. At the end of Q1, they had $473 million in cash and equivalents. Keep in mind, this does not include the $50 million from Nvidia or the Q2 cash burn. Q1 R&D cost was $46 million, up 44% year over year due to increased platform costs. General administrative expenses were $23 million in the quarter, up only 8% year over year, showing the restraint in spending hinted at by the job postings. Net loss was $65 million, up 16% year over year, which is relatively modest considering all of the clinical programs they are concurrently moving forward. Speaking of clinical programs, let's do a quick update, starting with cerebral cavernous malformation, which the majority of patients have enrolled in a phase 2 study and expect to share data in the second half of next year. Most of these patients have already completed their first year and are already enrolled in a long-term extension. Their treatment for neurofibrosis type 2 is enrolling in a phase 2 trial and expects interim safety data in 2024. They continue to advance their phase 2 trial for FAP and plan to initiate an open-label phase 2 trial for APC mutant cancers in 2024 as well. They have enrolled the majority of patients in the phase 1 trial for C. diff colitis, and the treatment has been well tolerated so far. They expect safety and pharmacokinetics data in the second half of this year. Now let's move on to an excellent video Recursion released on their YouTube channel describing their process of how they go from target to hit. I highly recommend you check it out, the link will be below. They start with a relevant gene of interest, which was stated as a given in the video, and I would like to hear more about how they get to this point. Entering the gene of interest into their map application system allows them to compare these genes with each other and to other potentially relevant entities in a heat map shown here. Dark red shows highly similar relationships, while blue shows highly opposite relationships. This was developed only using images of cells where each gene has been knocked out independently. Recursion's AI then used a mathematical representation to display these relationships in a heat map like this. They then used tools provided by Recursion to explore and analyze these relationships using known biological relationships and Recursion's proprietary experiments. They can then query the system to look for relationships between the selected genetic perturbations and small molecules that they have profiled. They can then easily select molecules to confirm relationships using Recursion's automated lab. They can then easily dive into the results shown here where healthy diseased cells treated with a certain compound are rescued to healthy cells. They can then follow up with orthogonal assays to confirm these relationships as shown here. This, I'm sure, is a vastly simplified version of the true process, but provides investors with a sense of what needs to happen for Recursion to develop a hit for potential treatment. One of the most exciting things about this to me is that this was performed on a known part of biology confirmed independently of Recursion, yet their system picked it up from scratch. This is one of my favorite pieces of evidence that Recursion's OS will be successful in uncovering new areas of biology. Let's jump into my highlights from download day. Recursion, the company, started with two original questions. First, could images of cells unlock orders of magnitude more data, which would allow you to create a map of biological and chemical relationships? Then, could you use these massive varied datasets and maps that they created to turn discovery into a search query? These are the questions that the Recursion team set out to answer about a decade ago, and they feel closer today to affirmation than ever, according to the team. Like I spoke about a moment ago, the best evidence that supports this is that their experiments today recreate independently identified and verified biological phenomena on their own. What you're seeing on screen is a set of genes related to breast cancer. This was created by Recursion scientists in their labs. This rediscovered a known pathway of biology. Recursion can then go from gene-to-gene relationships to gene-to-chemical relationships, shown here. Here are some well-known compounds to these genes with relationships that you would expect to see, all recapitulated by Recursion's OS. You'll notice that there are a lot of gaps in this graphic. Let's let Recursion fill them in for us. These are the rest of the compounds in Recursion's data universe that show strong relationships to these gene pathways. These could now all be starting points for Recursion's treatments that may have had similar effects to those already approved. If science had not done years of work to understand these pathways, Recursion could have taken any of these as starting points to drive towards successful treatment. So not only can Recursion re-uncover known biology, but they can discover new biology, and importantly, they can relate that to new chemical entities that could be potential treatments. Let's go through how they do it from hit to IND studies on a broad level, and then we'll look at a very promising example. This begins by using phenomics for hit generation. They start with a disease-modeled cells using anything from knocked out genes to toxins. They take snapshots of these cells in disease states as well as in healthy states and use their machine learning algorithms to differentiate between the two. Scientists can then add chemical entities identified by Recursion's OS to see what rescues the diseased cells back towards the healthy cells. The differences and changes between the three, when contextualized by ML, can allow scientists to uncover chemical entities that may be of interest for further testing. Step 2 is validation of these hits using transcriptomics assays, which analyze the RNA transcripts produced by the genotype with the given disease model and chemical entity. Recursion can run these at scale as well, with capacity for 15,000 a week. Step 3 includes further analysis of the candidate using in vivo omics to measure animal data. In vivo omics is a term that Recursion has coined to describe their method of collecting animal data and allows them to develop animal models in 2 months, understand how well a treatment is being tolerated in real time, and understand toxicity in less than a week, all of which is significantly faster than industry standard. One of the ways they do this is with continuous monitoring of animal behavior. This gives them more data with less bias faster than traditional methods. For more info on in vivo omics, check out page 19 of Recursion's 2023 ESG report, or if you'd like a dedicated video exploring more in depth, let me know in the comments below. I really like to see that Recursion is innovating in every part of development, even in animal models, to accelerate treatment to the market. Their chemistry acumen is no exception to this, where they are working to shrink time spent, decrease the number of cycles needed, and increase the throughput for each of the 4 phases of designing a new chemical entity. In the design phase, they're developing generative chemistry algorithms to optimize multiple factors within treatment. This would allow them to optimize for both tolerability and the target treatment effect. In the analysis phase, they need to develop machine learning models that can work with small amounts of data in the beginning of a cycle. This requires learning from history and generalizing those learnings to apply to a new specific dataset to be effective. They took learnings from LLMs and created MoleE, which does just that and performs very well in benchmarks for the task. For testing, they've set up automated DMPK assays, which test for absorption, distribution, metabolism, excretion, and potential toxicity of the candidate, and can run up to 500 compounds per week on the automated platform. This is not only enough for development, but also enough to generate more data for use in ML. Finally, to make the molecules, Recursion will develop automated microsynthesis capabilities to enable broader tests and faster turnaround times for the collection of new data. This automated chemistry capabilities will accelerate the development of new chemical energies for use in new treatments. One of the most insightful segments was when they detailed the development of a treatment that would be both tolerable and enhance immunotherapy response. To give some background, for those eligible for immunotherapy treatments, a huge fraction have no response, and a large part of those cannot take the treatment due to its side effects. Recursion's goal was to increase the response and minimize the side effects simultaneously. This started by evaluating 110 genes from a public CRISPR screening database that were well-known sensitization and resistance markers, and then pulled out those genes onto Recursion's map, shown here. From this, they identified an unexpected druggable gene, gene A, known as an immune modulator, shown here. They also identified gene B, which is a resistance marker for immunotherapy. They confirmed that this chemical entity is active against both gene A and gene B, and they now had a treatment that would potentially target both a known immune modulator and a resistance marker for immunotherapy. This would adjust both of their goals for this treatment. They put this in animal models and observed the response they were looking for and a decrease in side effects. The map also helped Recursion scientists to stay laser focused during the chemical optimization process when the chemists found an entity that improved what they were looking for. They were excited about this, but only for a moment, as when they phenotyped the new candidate, this wasn't similar at all to the target. They were then able to ditch the new entity and stick with the other because they knew it would not work for the goals of their treatment. This is the power of these maps at work, as they were the sole guide in the development of this lead. They gave another similar example for the treatment of HR-proficient ovarian cancer, and I'll leave the timestamps on screen if you're interested. For this treatment, they detailed how they used their in vivo omics platform that I mentioned earlier to select molecules and doses to take in efficacy studies and later the clinic. Some of these results can be seen here with the results of the in vivo omics model. These show the activity of mice with different small molecules at different doses. The top one shows an entity that is tolerated well at an efficacious dose. The middle shows safety concerns at an efficacious dose, as displayed by the drop in activity, especially as the study progresses. The third shows increased tolerability over the second as well as the first, and is what they will advance with so far. These are some pretty interesting results, and it was good to see them displayed in such a clear way. This is a great example of how Recursion is utilizing the full power of their operating system to advance the discovery process in a unique way. Finally, for my conclusions, I've never been more excited about Recursion. They are making every right move to set themselves up going forward. I love how they're looking at every part of the R&D process and are investing up front with the focus on speeding it up and making its utility more potent. This will maximize future value of the company, which is what I want as an investor. I am foregoing short-term profits in the hopes of having a much more valuable company in the future from their investments today. They still have an arduous road ahead as they need to prove out their platform by getting multiple treatments approved and into the market. Once they do, the sky's the limit for this company. I really found Download Day to be insightful and would recommend anyone researching Recursion to check it out, linked below. As for my position with Recursion, it makes up about 8% of my portfolio after the recent run at a $10.45 cost basis. At roughly $15 a share now and a $3 billion market cap, I no longer feel like Recursion is a steal like it was below $5, but will continue to pick up shares going forward. For me especially, it's important to keep perspective about buying when coming out of a dip. Remember, Recursion IPO'd at just $18 a share 2 years ago, which is a similar valuation after dilution to where we are now. It's especially important to keep perspective when buying potentially generational companies like Recursion may be. For example, Tesla was a screaming buy after its first 10x, and the same is true with Amazon, Netflix, and many others. I'll admit that it is hard to stomach buying more when you can think back to paying just 1/10 of the current price. What's important in my opinion is to stay laser focused on what the company will do in the future and if the current price is fair. For Recursion, I think the current price is fair because I see such huge potential ahead for them, and while I wish I was buying more under $5 a share, I will still be picking up shares as I have capital around. Thank you for watching and have a great rest of your day.